اللعين الرجيم بسم الله الرحمن الرحيم السلام عليكم ورحمة الله وبركاته. So first and foremost, before I begin, it was quite pleasing to see the amount of children that were given the opportunity and had the bravery to be up on the mic and recite the manqabats in front of you. So just in their honor, in honor of their families who have given them the support, but also as an encouragement for them and that their manqabats are accepted, please can I ask you to recite with your loudest of voices, Salawat ala Muhammad wa ali Muhammad. So if I could ask everyone just to look at the screen over there. So I'm going to be talking a little bit about coronavirus. I'm sure, no doubt, you'll have heard lots and lots about it. But this is something that's taken from a more pragmatic medical view. So I guess first question you'd probably ask is why am I standing here? So I'm a GP. I'm based in Leicester. Some of you are my patients. I'm also one of the chairs on the committee discussing coronavirus with all the important stakeholders. So Public Health England, one of the leading virologists that's looking at tackling and containing coronavirus around the world. So I'm up to date with medical guidance, and over the next week or so, we're looking at bringing together all the faith leaders, so Sheikh will probably be part of this, all the faith leaders within Leicestershire to have a meeting with Public Health to discuss where we stand as a faith centre going forward. So first and foremost, it's useful for you guys to have an untainted view, because I know the media put various spins on it and people get WhatsApp forwards, which perhaps may not be correct. So coronavirus is a virus just like the common cold, and its distance of spread has been estimated to be about 2 meters. So 2 meters on everywhere around you within your breathing zone. It can be breathed in, it can land on surfaces, so for example pulpits, this microphone potentially, and can be transferred when shaking hands or hugging or sharing the same drinks or the same utensils as someone else who has the virus. After contracting the virus, people don't really start sharing the virus with other people until about 24 hours afterwards. And some of the main symptoms are cough and fever. The virus can live for several hours on an average surface. It's been found in certain situations, in certain climates, it can live up to a few days as long as the conditions are okay for it. And that's certainly the case in Iran, certainly the case in the more Mediterranean regions like Italy. This is why it's becoming such a big problem there, is because it's warm and it allows a surface for the virus to remain alive. Here in the UK, we're not so much troubled by that outdoors because it's quite cold and the virus doesn't tend to survive very long outdoors. But inside, it's warm, and so it can potentially live for quite a few days. But the average survival time is a few hours. So what can we do within the community? And I had better fonts, but I think the PowerPoint application in the AV room doesn't have the same font as I did. So some of the things you can do. So if you've come back from an endemic area, for example, Iran being one of those areas that we visit frequently, or North Italy, and you've been in contact with anyone with coronavirus, the recommendation is that you stay away from the mosque for 14 days. And this also applies to the rest of your families as well. So if you're living with your family, anyone that's been in contact with you since you've come back, it's recommended that you don't come to the mosque for 14 days. You go into self-quarantine. Okay, this isn't going forward. Okay, fine. So within the community, the other thing that we can do is bringing your own prayer mats and chadars rather than using the communal prayer mats that are there in the masjid. So bring your own prayer mats with you for the ladies, bring your own chadars rather than using ones that are shared. Same if you, for example, pray in hospitals or in your place of work. If there's a communal prayer room, I'd recommend you take your own prayer mats with you. Now, this one is what's medically advisable, but I don't know where we stand religiously from this point of view. But the recommendation is that you keep a distance of 2 meters between the middle of your prayer mat and the one next to you. Now, I know with congregational prayers, this may create a problem, and perhaps it's a discussion that we could have about what we can do, whether congregational prayers are paused for a period of time, or whether it's something that can be accommodated with our prayers. No handshaking. So I know that we as a community are very much into handshaking as a gesture of closeness, also a gesture of celebration and congratulations. But particularly during this time, it's important to avoid the risk of transmission from one person to another, because people don't necessarily need to be unwell. There's a small proportion of people who don't exhibit any symptoms but can carry the virus within them and pass that on to other people. And that's how it's spread in China and in North Italy, which is why there's been such a massive proliferation of the virus, is because there were a large population that didn't exhibit any symptoms but passed it on to other people, perhaps even the most vulnerable within our communities. Avoid communal eating as well. So what this entails for tabarukat, for niyaz, it might perhaps be better to have ready packaged bags that people can take away with them and eat at home. I don't know what's going on here. There we go. Okay, so avoid communal towel and use tissues instead. So I know that that's already been implemented. So making sure that you don't use other things that potentially other people will have washed their hands with and touched anything else with. So communal towels, to avoid using those. The recommendation from Public Health England for anyone that goes to any faith centre is that if you develop flu-like symptoms, as a precaution to stay away from the mosque for 14 days, or if you have a confirmed negative swab test for coronavirus. And we'll get into how those swabs are done in a second. This is all summarized. So perhaps one of the most important things that we as a community can do is to remember our hygiene. And I'll show you a couple of slides on that in a second. But also avoiding things that are avoidable, because it's important to remember that we ourselves may be robust, we may be completely healthy, have no other underlying conditions like diabetes or anything like that. But what one of the risks is that if you don't pay heed to this advice, you are at very high risk of transmitting it to some of the more vulnerable members of our community. And that could potentially result in people within our own community dying as a direct consequence of things that we have done. So it's important as much as you can, because if you look all around the UK, there are mosques closing down up and down the country, and we, alhamdulillah, are in a position where we haven't shut down. But that will only stay the case if we follow the advice given by Public Health England, also follow the advice that I've summarized here, and some of the advice that the MC are giving, in that making sure that we don't shake hands with each other. If you are unwell, or if you've come back from Iran, you may not be unwell, but still, you may be potentially harboring the virus, and it may not show yet. It may be that you may not have any symptoms yet, but you could end up infecting a lot of people. So if you have come back from any of the endemic areas since the 26th of December, particularly Iran, North Italy, China, Singapore, Vietnam, Cambodia, there's a list of 26 countries on the government's website. If you have come back from any of those places since the 26th of December, we'd recommend a period of quarantine for 14 days. And if you've already undergone that, then that's fine. But the other thing to bear in mind is that now in China, the virus is mutating. So there are people in China who have now been infected with coronavirus twice. So they've recovered from the first one, the virus is mutated, so they recovered in December, the virus is mutated, and they became infected at the end of February. This is one of the very real problems that people have with coronavirus, is that we can't predict what it's going to do. With flu, it's been around for almost 100 years. We know what it can do. There are immunizations that are developed. There's treatments such as Tamiflu. With coronavirus, there is no immunization. There are no treatments. The people are trying things like anti-HIV medication, which is helping some people but not helping others. There's no real treatment for it. But the other thing is that we don't know what the long-term implications are of coronavirus, okay? So, if you do have symptoms, particularly a cough and a fever, ring 111. Do not go to see your GP or to the urgent care center or to A&E or to come and see Sheikh. I'm sure he wouldn't want to see you if you've got a cough and a fever. Ring 111 straight away. Okay? Hand washing, so the recommendation is for 20 seconds after touching anything and before eating anything. Okay, and this is soap and water for 20 seconds. And if you don't have access to soap and water, using an alcohol-based hand sanitizer, which contains at least 60% alcohol. Okay? Avoid regular touching of your face. I know those of us with beards, it's a bit itchy, it's a bit hard to control that, but if you can, avoid regular touching of your face. If you are coughing or sneezing, try to cover your mouth and nose with a tissue, or failing that, your bent elbow. But if you can, with a tissue, and as soon as you cough or sneeze into it, dispose of that into a bin that has a lid on it or that is covered, and then wash your hands straight after. And clearly stay home if you feel unwell. Okay, so this is just all of that summarized. So make sure you wash your hands after all of that. So for example, after coughing or sneezing, after caring or when caring for people that are sick or dependent on you, before, during and after you prepare food, before eating, after using the toilet, when your hands are visibly dirty, after handling animals or animal waste for those of us with pets, making sure that you wash your hands with soap and running water, alcohol-based hand sanitizer we've talked about, and the old catch it, bin it, kill it. Catch your cough or sneeze in a tissue, put it in a bin with a lid on it, and then wash your hands straight after. So does anyone have any questions about coronavirus at all? Don't feel afraid to ask. How can we enhance our immunity? I think, to be honest, there isn't much that can be done. If you use the basic hygiene methods that we've talked about, if we try to avoid things that can transmit the virus to each other, we can stay safe from coronavirus as much as possible.
It's very difficult, right?
Absolutely, absolutely.
But there has to be something that enhances your body to fight against it.
To enhance your body, so I guess if we start from the very basics, if you have a condition which makes you more susceptible, so for example diabetes, making sure your blood sugars are in very good control, making sure that if you have any deficiencies of nutrients, for example those of us that are deficient in vitamin D, which let's be honest will probably be all of us, making sure that you take a multivitamin that contains vitamin D to again enhance your immunity. If you're on antibiotics, making sure that you take them and adhere to your medication treatment plan. Other than that, there isn't really anything else apart from sanitization and keeping clean. Any other questions? No? Okay. So before I finish, so obviously I've put everyone in quite a depressing mood. I just wanted to recite a couple of lines of poetry for you. So, Dare Haidar se shariyat ka pata milta hai. Dare Haidar se shariyat ka pata milta hai. Mangane walon ko payam-e baqa milta hai. दरे हैदर से शरीयत का पता मिलता है, मांगने वालों को पयाम बका मिलता है। अरे इस दर से मत पूछिए कि क्या मिलता है, इस दर से मत पूछिए कि क्या मिलता है। अरे जिसे अली मिल जाए उसे खुदा मिलता है, जिसे अली मिल जाए उसे खुदा मिलता है। Which is why a poet has beautifully said, हक्का हकीकतन मुझे हामिल बना दिया, हक्का हकीकतन मुझे हामिल बना दिया, महफिल में रौनक महफिल बना दिया। अरे पैदा हुए अली तो ये बोला खुदा का घर, पैदा हुए अली तो ये बोला खुदा का घर, तूने मुझे तवाफ के काबिल बना दिया, तूने मुझे तवाफ के काबिल बना दिया। दुरूद पढ़े मोहम्मद वाल मोहम्मद पर।